Today we'll be looking at the uniqueness of temporomandibular joint as compared to other joints in our body. So let's just look at the different joints that we have in our body. So all of them can be classified into three types of joints. We have fibrous joints, we have cartilaginous joints, and then we have the synovial joints. Now we'll be looking briefly at examples of all these three joints. So now here are the examples of the three types of joints. The first being the fibrous joint. So we have two examples of fibrous joint. The first is the spheno-occipital synchondrosis. Now this is where the sphenoid bone joins with the occipital bone, and here it is. So the spheno-occipital synchondrosis is an example of the fibrous joint, as well as the tooth socket joint, which is also known as gomphosis. So gomphosis and spheno-occipital synchondrosis are fibrous joints. Then we have the primary cartilaginous joint. The primary cartilaginous joint is the joint of the rib cage, and this is known as the costochondral joint. Here this is the costochondral joint, and this is a primary cartilaginous joint where there is hyaline cartilage. And then we have the secondary cartilaginous joint, and this is the symphysis pubae. Now here there's a joint between the os pubae, and is known as the symphysis pubae, and this is actually a secondary cartilaginous joint. Now the third type of joint is the synovial joint. These synovial joint, here this is an example of the hip bone with the femur bone, the hip socket joint, which is formed from the hip bone as well as the femur bone. Now of the acetabulum and the os coxae. Similarly, synovial joints are the knee joints and the elbow joint. All of these are examples of synovial joint. So temporomandibular joint is an example of synovial joint, and this is a synovial joint because it has a synovial membrane that lines it, and it has synovial fluid which is secreted by this synovial membrane lining, and then we have an articular disc which is interposed in between the condylar head and the inferotemporal fossa or the temporal bone. So temporomandibular joint is an example of synovial joint, but it is different from all other synovial joints, and we'll be looking at this difference right now. Now another uniqueness of temporomandibular joint is that this is the only synovial joint in our body which has two ranges of movement. The first movement is the hinge joint, or the hinge joint movement. It is rotation along its hinge axis, just like when we are opening the door actually opens and closes around its hinge. The hinge doesn't move, the hinge stays at the same place, but the door moves. So similarly, the condyle, it just rotates around its horizontal axis, while the mouth is opened and closed, and it stays there, the condyle, within the articular disc assembly. It doesn't move. So this is the first type of movement. The second type of movement is the sliding movement, and this sliding movement means that the condyle actually goes goes towards the articular eminence in the temporomandibular joint and actually moves. So the condylar head actually moves through the condylar disc assembly, and this is known as translation or sliding movement. So temporomandibular joint is a synovial sliding gangliomoid joint. By gangliomoid we mean hinge movement, and sliding means the translatory movement. So the uniqueness of temporomandibular joint as compared to other joints is that it has the presence of articular disc. As compared to other synovial joints usually have hyaline cartilage, while temporomandibular joint has a fibrocartilage in it. And this fibrocartilage, or the interarticular disc, divides the joint cavity, which is formed above the condylar head and below the inferotemporal fossa, into two joint cavities, the upper joint cavity and the lower joint cavity. So the superior joint cavity is primarily responsible for the sliding movement or the translatory movement, while the lower joint cavity is involved in the rotation or the hinge movement. So the mouth opening up to the 20 millimeters takes place in the inferior cavity, while beyond 20 millimeters translation takes place in the superior cavity. Now both of these cavities, the superior cavity as well as the inferior cavity, they are lined by the synovial fluid, and the fluid in the lower joint cavity is uh, slightly more as compared to the upper joint cavity, but it's around 1 millimeters in the inferior and 1 millimeter in the superior joint cavity. So we'll briefly look at the different unusual or unique features of temporomandibular joint. So we've already talked about the interarticular disc that divides the two joint spaces. And then we have the articular surfaces that are lined by fibrous tissue as compared to hyaline tissue, which are present in other synovial joints, namely the knee joint, the hip joint, and the elbow joint. Another important feature is the presence of secondary cartilage, secondary condylar cartilage, and then the movements of temporomandibular joint actually influenced by teeth, and the right and left joints cannot move independently. So the secondary condylar cartilage is present in the head of the condyle till adolescence, till the second decade of life, and it is primarily responsible for the growth and development. Although mandible, it develops intramembranously, but intercondylar ossification is still possible in the head of the condyle to the second decade of life. This is another unique feature of temporomandibular joint. The movements of the joint are influenced by the teeth. So whether how the teeth are moving, the temporomandibular joint actually accompanies the movement of the teeth and the mouth opening. As we've already talked about, around 20 millimeters, only the lower joint space is involved, and there is primarily rotational movement. But beyond the 20 millimeter mouth opening, the upper joint space is involved, and then there is rotational movement as well as the sliding or translatory movement. Now most of our body joints are supported mainly by muscles, but temporomandibular joint is the only joint that is supported mainly by ligaments. Now another important feature is crimping of collagen fibers in the articular disc. Now as you can see, these are actually different sections of the articular disc which are being viewed by macroscopy, by interference microscopy, and they actually show us undulating or undulating waves of crimps of collagen fibers that have crimped together. Now this crimping of collagen fibers within the articular disc indicates that it is undergoing tensional loads as well as compressive loads, and these loads are common during mastication and chewing, as well as mouth opening beyond the 20 millimeter. So, and these features are unique since these features are present only in the articular disc, and these are not present in any hyaline cartilage of the synovial joint. And lastly, as you know, our synovial joints, specifically the knee joint and the hip joint and the elbow joint, they undergo osteoarthritis as well as rheumatoid arthritis with age. So osteoarthritis is an age-related degenerative joint disease which is caused by the breakdown of the cartilage between the joint bones. And rheumatoid arthritis is an autoimmune disease in which there is inflammation, which is chronic inflammation of the joint space. Now luckily or fortunately, our temporomandibular joint is least affected joint in both osteoarthritis and rheumatoid arthritis. So even though patients who are suffering from osteoarthritis and rheumatoid arthritis, they might have pain and their movement might be restricted in other synovial joints such as the hip joint or the knee joint or the elbow joint, but they are able to use their temporomandibular joint to a larger degree. They can eat and masticate properly, and this is another feature of temporomandibular joint, and one of the reasons why temporomandibular joint is not as affected in osteoarthritis or rheumatoid arthritis is because it doesn't have any hyaline cartilage and it has fibrocartilage. So that is all for now. Hope this video has been useful for you, don't forget to like and comment in the box. Thank you.